Thank you for watching SheTV.com, your source for accurate information about women's health. This video will guide you through your colonoscopy journey at Lakeside Women's Hospital.
Hi, I'm Holly. I'm one of the nurses here at Lakeside's endoscopy department.
Hi, I'm Kara. I'm one of the other nurses at the Lakeside endoscopy department.
We're going to be filming a video that's meant to be informational regarding your prep and how the day of your colonoscopy will go. Kara is going to be posing as our patient for today. All right, Kara, so you've been scheduled for a colonoscopy procedure.
Yes.
So we're going to talk through what you can expect with the procedure and the prep that you'll be doing.
Okay.
So 1 to 2 weeks prior to your procedure, you're going to receive a call from a nurse, one of our nurses here, and she's going to review your medications, your health history, and she'll go over your prep instructions. So it should just take 10 to 15 minutes for that phone call. And then after the phone call, you'll receive an email with instructions, and you'll want to pick up your prescription we call in from your pharmacy.
And what are you calling in?
We will call in a bowel prep. So after we go through your questions, we'll decide what bowel prep will be best for you, and we'll call that specific one into the pharmacy. So
When do I start that?
you'll start that the day before the procedure. So you'll be on a clear liquid diet the entire day before, and then you'll start the bowel prep the evening before. Have you ever been on a clear liquid diet before?
No, what is a clear liquid diet?
Clear liquid diet is total liquids throughout the day, anything that light can pass through. So you can have things like lemonade, tea, juices, as long as they're clear, like apple juice. You cannot have orange juice because you wouldn't be able to see the light through it. You can have coffee, jello, popsicles. All of those things are okay to have.
Okay. You said that I can have coffee. Can I put creamer in my coffee?
You cannot put creamer in your coffee. It needs to be black coffee, but you are able to have it.
Okay. But I can have Coke.
You can have Coke.
And why can't I have creamer?
You're not allowed to have creamer because if you threw up during the procedure, aspirated and inhaled it into your lungs, that could be really damaging to your lungs. So we just want to make sure you're as safe as possible. That's why we restrict you from having any creamer.
What about a milkshake or a smoothie? Can I have one of them?
You can't have a milkshake or a smoothie because if you can envision holding it up to the light, you wouldn't be able to see light through it.
Okay.
And we want to make sure that you're as clean as possible. So doing that clear liquid diet cleans out your colon and keeps it from building up stool. We also don't want you to have anything red or purple. So if you're buying jello and popsicles, just make sure you're buying colors other than red or purple.
Okay.
All right. We're going to prescribe you Plenvu.
Okay.
So this is what it looks like. So when you get this box, you'll open it up. It includes the little jug. And then this is where the medication is.
Now, do I go by these instructions on the box?
You don't go by these instructions. You're going to go by the instructions that we email to you. This is your prescription. It has 3 packets. So
Okay.
this one is your first one. You're going to pour it into the jug that's included. And you'll just fill it to the fill line with water, shake it up. You can refrigerate this.
Okay.
Prior to drinking, you'll drink this one. That's going to start at 6 p.m. the evening before your procedure.
Okay.
So you'll be on clear liquid diet the whole day, and then you'll drink this 6 p.m. the evening before. These two you're going to combine in here. Also fill it to the fill line. This one is going to be 6 hours prior to the procedure. Okay, so if you have an early morning procedure scheduled, you may have to be waking up in the middle of the night to drink the second bottle.
So I may have to get up at like 2, 3 o'clock in the morning.
You might, which
Okay.
I know is a bummer, but it's one day of your life, and it just makes sure you're as clean as possible by going through that second dose.
Do I need to drink anything else besides just this prep?
Yes, so we do want you to drink water or Gatorade, something in addition to the prep, and your instructions will tell you exactly how much, but we just want to make sure you're really washing this prep through and that you're trying to stay hydrated. So this does dehydrate you, so we want you to drink water in addition to prep.
What if I start getting nauseated?
That can happen, so if you start feeling nauseous, we want you to slow down. You don't have to chug the whole thing in 5 minutes, so really slow down. You can drink through a straw, sometimes that helps.
Okay.
You can swap it out and drink some Sprite for a little bit just to kind of settle your stomach, and then pick it up and try to get going again.
Okay, what What can I expect after I drink this? How long before I start going to the bathroom?
Well, everybody's different. Some people, it starts very, very quick. Others, it can take up to an hour or so. But you definitely want to be close to a bathroom. So don't take this and then go to an activity or go to your son's basketball game or anything like that. You want to be close to a restroom, preferably at home or at a hotel if you're from out of town. Just make sure you're close because it's going to start and it'll be frequent bathroom visits.
Okay, and I have to drink all of it?
Yes,
okay.
You need to finish it. That's very important. You're looking for your stool to be clearish with a yellow tinge. That's a good sign that you've gotten flushed and cleaned out.
Okay. And does the procedure happen in this room?
It does not. This is one of our pre-op area, one of our rooms. So this is where you'll come on the day of the procedure. We'll bring you in here, get your vitals, have you change, start an IV, ask you all of our questions, and then we'll bring your driver, your family member back with you. The procedure is done in a different room, so we'll wheel you out of here on the bed, and then we'll bring you back still asleep, and this is where you'll wake up. We'll continue getting vitals and making sure you're good to go, and then we'll let you change and be on your way.
Can I drive that day?
You cannot drive. You need to have a driver with you. You have been sedated by the anesthesiologist, and so you are restricted from driving for the rest of that day.
And does my driver have to stay here with me the whole time?
They don't have to stay here, but it is recommended. So the physician will come and chat with you and your driver or family member after the procedure. So it's helpful for you to have a family member present that can kind of advocate for you, and you may not remember that discussion, and so it's great if they're here to make notes and remember everything.
Okay.
Do you have any other questions about the day of the procedure?
Is the procedure painful?
It shouldn't be, no. We do use gas to inflate the colon as we travel through, so if anything, you may wake up with just a little bit of gas cramps, but as soon as you pass that gas, you should be pain-free. So most people don't say they have any pain.
Okay. So my other question, when I had my hysterectomy, I got really nauseated afterwards and threw up. Is that going to happen this time?
That should not happen this time. So with your hysterectomy, you would have had general anesthesia. This is a type of medication that goes through your IV. Generally, patients don't wake up with any nausea or vomiting, even if that's happened before with that general anesthesia. We don't expect that to happen. We do have medication if for some reason it does, or you wake up feeling sick, but I would say 98% of our patients wake up feeling great.
And I'm very modest, so what happens in the procedure room? Like, am I going to be exposed? Yeah.
So we take everyone's modesty very seriously. We will wheel you into the procedure room. You'll be completely covered with your gown and a blanket. We will have you positioned on your side for us, but you'll stay covered the whole time. And then we won't actually do any uncovering until you're asleep. And even then we'll lay a towel over you, so really nothing is seen. The physician sees a little bit, but the rest of the time you're covered with a towel and you stay very covered up and modest throughout the procedure.
Okay.
Does that put your mind at ease a little bit?
Yeah, that makes me feel better.
Okay, good.
So the day of my procedure, will I know if I had any polyps or if there was any cancer or anything like that?
Yes. So the physician will come out and chat with you the day of the procedure after it's over, and he or she will let you know what they found, if they have any major concerns. If they took polyps or biopsies, we do send those off to pathology, and that takes 7 to 10 days to receive the official report. And then their office will call you with the official report. But the day of, you'll know, what they took and if they have any big concerns of, a large mass or anything like that.
Okay. So how long does all of this take?
You can expect to be here about 2 hours total. So you'll get here an hour before your procedure. That's when we do all of your pre-op things, start your IV, take vitals. Then the procedure itself takes about 20 to 30 minutes, and it's another 20 to 30 for you to wake up and recover and be ready to go home. So about 2 hours.
Okay.
This is not where the procedure's done. This is one of our pre-procedure rooms. So when you arrive, we'll bring you in here, we'll have you change clothes, You'll sit on this bed, we'll hook up this wonderful heater and put a warm blanket over you, and then we'll get vitals, go through the pre-procedure instructions, and start your IV.
And then where do I go after my procedure?
So we'll wheel you out of this bed to the procedure, and then we'll bring you back in this same room afterwards. So your family member or driver will still be in here.
Okay.
We'll bring you back in, and this is where you'll wake up. Then your anesthesiologist and the physician performing the procedure, they will come talk with you beforehand, make sure they answer any questions, and then they'll also come see you again after the procedure just to make sure you're doing okay and let you know what was found during the procedure. All right, Kara, do you want to take a look at the procedure room? All right, Kara, come on in. So this is where the procedure will be performed. So we're going to wheel you in here head first on your stretcher. So you'll be facing the door like this. We'll go ahead and put some oxygen on your face. We'll hook you up to our vital machine and get a set of vitals. And then we'll have you help position. So we'll have you roll onto your left side. Okay. You'll be modest and covered the whole time. And then once everybody on the care team is in the room, we'll go ahead and the anesthesiologist will get you put to sleep and we'll get started. And the next thing you know, you'll be waking up back in your pre-procedure area. Okay. Well, hopefully you found this video informative and it will put your mind at ease for your procedure you're having with us. If you have any questions, you can always call our department. And thanks for watching.